All right, welcome to our call this week, this month on program management techniques. My name's Lawrence Heiner. I'm the Director of Training and Technical Assistance at Cal Kappa. Welcome to the call. I know that we've got a lot of folks on the call, some from California, some outside of California today. So um, thank you for joining us. If you'd like to drop in the chat your agency and where you're calling in from today, that'd be great and get an idea of who's participating today. With me, I have Jillian Keegan, who's going to be running the presentation. She has been doing great work with a diaper grant, research grant, and we're using that as an example for project management techniques. She's a wealth of information ready for you to go. So I'm going to let Jillian take it from here. So Jillian Keegan, welcome, and what do you have for us today?
Thanks, Lawrence. Well, hi everyone. I'm Jillian Keegan. Like Lawrence said, I'm the project manager here at Cal Kappa. And for the last a little over a year now, I have been sort of the lead contact for the DDDRP program, which is the Diaper Demonstration, Distribution, Research, and Pilot Program. And we have four agencies across the state that are currently participating in this program. We have Dorabelle from Merced actually on today. She is the main diaper contact down at Merced. So thank you, Dorabelle, for joining us. And just in general, I was talking about today program management techniques and how we can use whole family assessments to improve community action programs as a whole. So for just a little bit of background, the DDDRP is a research and demonstration pilot program, like I said. And so it really looks at using diaper services to be a sort of anchor for families to get a load of wraparound services from community action agencies. And so, in order to determine what those families need, right at the start, diaper agencies go ahead and give these family assessments so that we know they need more than just diapers, they might need a few other things. So, like the Community Action Network always strives, just be to well, strives to better their communities and to address the complex issues that families face. So hopefully these family assessments can help us do that in all sorts of different programs. So to start off, I just wanted to mention some of these objectives. The first is just understanding why I'm even suggesting we add this to our day-to-day work in the first place. The next is to introduce the specific tool that we use, and then to demonstrate how scoring can guide program management at different times throughout the program, and explore how data can inform program design and improvement. And then finally, I'm just going to give a few tips to implement holistic family assessments if this is something that you may want to do in any of your programs. So first, why the whole family assessment, or why holistic assessments to begin with? Obviously, as we all know, poverty is multidimensional. Just like when you go to a doctor's office and they give you a clipboard with all the questions you have to answer right off the bat, there's a lot going into your sort of health or into poverty that we need to know in order to make adjustments where needed. So, if your goal is to help a family in poverty and you run an early childhood education center, for example, whole family assessments help you learn more about their other needs. And so, going into more of why, at community action agencies, a lot of our programs are siloed or specifically focused on one service area. So we have a lot of food banks, diaper banks, like I've mentioned, homeless shelters, workforce centers, energy assistance programs, but they're all sort of their own thing with their own staff. Um, and community action agencies are really like resource libraries and service connectors. And so the family assessments allows a sort of baseline and ongoing data to show how we connect our clients into all of these different aspects. I saw a comment, Pam, I have the presentation on the screen right now. I'm not sure if you're able to see it, but I'll be able to share it after as well. Okay, I'll go ahead and move on. So families face interconnected barriers. One example from the National Diaper Bank Network is 1 in 4 parents miss work or school because they can't afford the diapers that they need for their baby to be left in childcare. So obviously with no diapers, they lost their childcare. Without their childcare, maybe they missed employment for a day and they missed income for that day. And then in turn, they can't afford the diapers again. So it's a cycle of poverty, as we all know. And needs are not separate, they're compounding. So by better understanding all of the needs of a family, we can better plug them into the specific areas that, they really need the most assistance in. And then finally, sort of a bigger picture is holistic tools lead to better case management and stronger program data. So wherever you may need that data, whether it's talking to legislators or funders or whatever, this really sets that data for you and it helps build a full picture of your family needs. And like I said, it prioritizes support in those areas of need and provides stronger data and better outcomes for those families. So going into what the assessment measures for the diaper program, we use an 11 scale matrix. Without the diaper need, it would be a 10 scale matrix based on these 10 areas. And using the results from the assessment, case managers, like I said, can enroll families in what the diaper program calls wraparound services based on their predetermined areas of need. So we measure, as you can see on the next page, these are the questions and they select, 0 to 10 in crisis to thriving. And there are specific scoring guidelines for each measure as well, because what in crisis means to one of us might mean something completely different to somebody else. So as you can see on here, there are different scoring guidelines for each of the scales so that, like if you're looking at housing, thriving means these things, vulnerable means these things. So there's no confusion when different case managers are filling out the assessments. To go back one slide real quick, like I said, this can be customizable to whatever your program does. So like I said, we're a diaper program, so we make sure we have this diaper question on there. Maybe you don't have a diaper program and you're not interested in measuring diaper need. That's something that you could leave off. Or maybe you don't have a diaper program and you are interested in measuring diaper need so that maybe down the line you can invest in a diaper program or look to funders and show them this data showing the need for a diaper program in your area. Could include that there. Same thing, energy and utility. Maybe you wanted to break this into an energy bill and a water bill question. You can really customize these to be what's best for your agency and for your families, while still getting a full, well-rounded picture of other things that maybe aren't currently being offered at your agency as well. So how we administer these tests, we have our case managers do these tests one-on-one with the families. You could always have them do it themselves at a separate time, but we found that this helps incite that conversation with case managers, and it really helps them build that trusting relationship. We do pre-testing, which is during the intake and eligibility process. We do mid-testing, which for us is about every 6 months. For you, that could be on different intervals if your program needs different intervals, or maybe you do a quarterly report. And for a post-test, that's just at the end, either when the family disenrolls from the program, because for us, that means they've reached self-sufficiency at purchasing diapers, or that they've moved out of the service area, or maybe your program has ended. That's when that post-test would go ahead and take place. And like I said, sometimes this does add, an extra step to case managers' workflow, but it does really help build the trust with the families. I know Dorabelle and Annie from Urban Services is on the call now too, and they've both noted that it really helps build those relationships and starting conversations with families who might not be super open to discussing what their needs are. So going into what this data can show us. So this is an example of what a family snapshot of the family assessment looks like at pre-test, mid-test, and post-test. So the primary needs that you can see obviously are diapers, energy, childcare, and employment. It looks like this family could really use some investment in those areas. And some secondary needs that were once vulnerable, but now are doing a little bit better are food, healthcare, and behavioral health. And the goal is after you look at these assessments, you assign goals to the families, and then you actually provide those services. So what we would want to see is that since this increased by 2, we would have likely seen some sort of food and nutrition services have been offered, or some education services had been offered, or healthcare or behavioral health had been offered. Um, so that really shows us what one family needs, and for case managers, this can be really helpful to know where to plug those families in. But it also shows us where we could have more impact if we had more resources to plug families in other spots as well. This is an example of one specific site. So this is actually from our site in San Francisco. And this lets us show sort of trends across the different program sites. So this is between assessments 1 and 2, and this is between assessments 1 and 3. And as you can see, there's a lot of positive growth in these areas at this program site, which would be really great data to show future funders. But at the same time, there's these other areas that help us ask questions. Okay, what's going on here? Where do we need to plug families into different areas? Where do we need to invest more money? I know this example in particular, transportation is one that has gone down since assessment 2, and in assessment 3. One of the reasons coming out of San Francisco that we talked about is transportation. Public transportation is increased to almost $3 per ride now. And they're cracking down a lot more on public transportation, on folks just hopping on and off. So that could be a reason why we see that. But it's just a really great way to put data with your stories and show a sort of full picture when you're explaining things to funders, and or to legislators or whoever you're explaining things to. And then finally, for the program snapshot, what we can learn from the whole program. So this is data from all our families at all of our sites. I ran some statistical analysis just between assessments 1 and 2. And so what all of these numbers say is basically, was there change between assessments 1 and 2 in the first 6 months? Was there change in any of these domains? And according to our data across all 11 domains, there was statistically significant change in these domains, which is really good. That means that our program was impactful across multiple domains, not just in the domain that is in the title, which is diapers. So that's, that was the ultimate goal of the program, and being able to show that is really powerful and positive information. Another thing I wanted to talk about is that holistic approaches help produce multiple outcomes for families. So like I said, this is a diaper program, but because it's a diaper program that also offers wraparound services, for example, like Doorbell, if she sees a family who is really struggling in their healthcare, she is getting that family all the brochures for all of the county resources in Merced related to health. And so that's a really great way, even if you aren't running that program yourself, you're able to get the resources to the families, and they're able to see outcomes in those areas, even when there wasn't necessarily a direct service right then and there between the CAA and the client. So all of this was a lot of great data, but so what? Why does this matter? The reason that it matters is because it helps with continuous improvement of our programs. So we always want to be looking at data to help improve what we're doing. And using trends to improve your service mix is one of the big things that come out of using whole family assessments. So this helps you identify which domains that families struggle with the most. This helps you create referral pathways, like I said, that address multiple needs. So maybe you need to reach out to other CBOs in your area to learn what they're offering, and see how you can refer them over to different programs. It also could help you create new programs within your community action agency. Another example I have is down in Kern, where we're doing this diaper program. They've noted a lot of transportation issues. One of the case managers there said that there's, I think, 5 buses that run in Kern County, and they all go to Bakersfield, only from 9 to 5, Monday through Friday. So transportation is something that they're looking into to see if there's anything that they can do to better help their clients. Obviously, they're not expecting transportation funding to come tomorrow because of this data, but it is something that has opened their eyes to see this is a real need for our families. What can we do to help fill this gap? And then finally, eliminating duplicated or underutilized services. So in some of our areas, there are other diaper banks already going on. So maybe the impact there under the diaper measure isn't as strong as in the areas where we have agencies with a diaper desert or no other diaper resources in the area. Next, it also helps develop staff training as you're going through your program. So it helps develop your training to align with the most common barriers that families face. So if a lot of families are experiencing housing issues, maybe you do a whole staff training on housing, or a lot of families are experiencing, energy issues, maybe let your staff know about all of the different energy resources in the county. One great resource that Lawrence actually turned me on to is called findhelp.org. And you just enter your zip code and it brings up, for example, if I were to enter 95630, which is my home zip code, it brings up all of the programs in the area that could help me with whatever I could possibly need. So this is really helpful for, like I said, maybe you don't have a lot of programs in your CAA, but you want to refer them, or you want to see some greater outcomes. Seeing where you can plug folks in, it would be really helpful. Going back over here, and then finally just educating your staff on providing case management services in general, whether that's having a agency, a budget worksheet that they can hand out and work with clients on, or, in an easy financial coaching class that they could give, something easy and quick that case managers can just give, and it's a quick service, but they can also see a good outcome come out of it. Next is advocating for funding. So like I've already said, data is the most compelling tool for funders. Obviously, storytelling is important, but you can't tell a story without the data. I've done 2 grant applications now, not that many, but 2. And both of them required me to talk about the need and talk about how we were going to fill those gaps. And with this data, you can very easily do that. It helps you drive your advocacy with Congress if that's something that you're doing. And like I said, it really provides concrete evidence to pursue those funding opportunities to show this is a real need in our community, and this is how we think that we can fill that need. And then finally, it helps inform strategic planning. So if you want to know about community action plans, community needs assessments, strategic plans, theories of change, all of that, having this concrete data can help guide long-term decision-making about programming, about staffing, and about resource allocation. It's kind of like an ongoing needs assessment that also produces measurable outcomes for families. So finally, I just wanted to get into some of the implementation tips. So as I said, the first thing you got to do is build your assessment. Maybe pick a program that you think would be a good program to start this in. Those siloed programs are good for this because it helps you see the more needs that families have. So like I said, we do this in our diaper program, and that really helps us see, yes, diapers are the main need, but here are all of the other needs that those families also have. Maybe for you, that's a food bank or your LIHEAP program or something where you could easily add this into a eligibility form or intake form to just measure that progress as you go. Another question that you might want to ask is, what tools will you use to create and distribute this assessment? With the DDDRP, we purchased a data system right off the bat. So we have our family assessment already ready to go in our data system where case managers go ahead and input all the rest of their data. And this is kind of how it's set up on ours. It could always be more user-friendly. So however you would want to set that up. And like I said, a lot of families do this in person when you're meeting with the case managers. I know some case managers have downloaded paper assessments if they'd rather, go through each question like that, however they see fit. And that kind of goes into what I was saying, choosing a tool that you already use to go ahead and do this intake and eligibility, whether that's a dedicated data system like Kinder Systems we use. There were 3 other images that are not showing up here. One of them is Empower, which a lot of our agencies use, and Sonoma, one of our diaper agencies, actually has made the switch over from Kinder Systems to Empower. So they have built out the family assessment fully in their Empower system already, which has also helped with their internal capacity as well. But just adjusting it so that it matches those intake and eligibility processes that you already have. So one of the barriers that was mentioned was that it does take time to go through these surveys and these assessments. So trying to fit it into your regular business processes as much as possible is definitely helpful. And then finally, one of the finalies is training your staff to be more consistent with their scoring. Like I said, there are pretty specific definitions for each scoring entity. So really making sure that your staff members know what each number means, what thriving means, what safe means, what stable means. Because like I said, if one person thinks in crisis is one thing and another person thinks it's another, it can affect your data. And then training your staff to have those deeper conversations with clients. Like I said, we've found that clients do want to have these conversations. It may be hard to get them to talk at first because they're not sure, or maybe it's their first time visiting the community action agency. But I know Dorabelle and Annie both said that once you get into it, they really open up about their needs and about everything that that you could possibly plug them into. And then lastly is reviewing data regularly. So obviously, the more often your data is reviewed, the more continuous improvement can occur. So you want to plan, implement, evaluate, and improve sort of constantly. I look at these family assessments every month because that sort of coincides with our meeting times for the diaper program, but you could look at this data however often or however not often you wanted to, whether that's weekly, quarterly, just every 6 months, or just during your needs assessment processes even. But ongoing adjustments to programs often lead to better outcomes. So the more you look at it, the better things can be. So finally, the big picture, obviously poverty is complex and there are a lot of factors that impact families in poverty, and programs should reflect family needs. Our network has been responding to the specific needs of their low-income communities for more than 60 years, and this is just another tool that helps us do that. And it also helps with better program planning, stronger reporting, deeper family engagement, and increased agency capacity. I went through this kind of fast, so Lawrence, I think we are at the end already. But if there are any questions, or if you have a specific program that you'd want to talk through about how this might work. I know one thing that I didn't mention that was in my notes to mention at some point was that another big funding that CAAs are getting right now are CalAIM programs, which a lot of them are enhanced case management programs. So this is kind of perfect for that. But yeah, just opening it up to questions, discussions. Lawrence, David, Dorabelle, Annie, I don't know if you had anything you'd like to share about your experiences with the family assessments as well. Dorabelle, are you on? Sorry, you're muted. No worries.
Sorry.
No
I
worries.
just like to mention the public health department, they have a program, it's like a postpartum care program, and they deliver the diapers to the families. Just in case you like to contact to them, and they deliver the diapers, and we working together, and it's and I
Yeah.
think that we're providing a wonderful service to the families.
Definitely. Doorbell has really worked hard at building those relationships and those partnerships with
Yes.
other areas in the county. And it's helped because one of the barriers for the diaper program has actually been getting families their diapers, making sure they have transportation to get those diapers.
Mhm.
And this has completely eliminated that barrier because of her partnerships with other county departments. They go ahead and deliver the diapers for her. So this sort of family assessment in this program has helped them build those partnerships and made it cheaper kind of to run this program because it's a free delivery on that.
Mm.
Yes, Pam, go ahead.
A couple of questions. First of all, are you willing to share that assessment? I always want to see other people's tools.
Yes, I can definitely share that.
Also, Darbel, you mentioned public health. Is that just your county public health, or is that statewide? Do you know?
I'm pretty sure they have in another countries too, because it's very strong, this program, and there is more than one program. Actually, there is like I'm serving more than 5 programs in Merced County, and I'm pretty sure you have it in your county. One is for public health department, the other one is a community health program, and another program, that's the recent one, is provided for the medical, I think, alliance. They need to qualify for alliance. When they qualify for that insurance, like a medical, they provide a service to deliver the diapers, some families, and they provide more than deliver diapers. They help with the rent, they help with the PG&E bills, and like food, clothes. They provide many services, but these are the programs. I can send it to Jillian, and she can give you the information, and you can check in your county for those programs.
Definitely. And Annie, I saw you come off camera. I don't know if you wanted to, I don't want to put you on the spot, but if you wanted to say anything.
No. Just I think regarding the assessments, yeah, like you mentioned, it's just kind of like a conversation starter, to get families engaged and yeah, open up a little bit more about some of the struggles they're going through, and then trying to find a resource to address it. Yeah, so it's been helpful.
Thank you. Are there any other questions or comments? Yeah, Pete, go ahead.
How will some of these programs be impacted with the potential changes that are coming down from the feds, though? At our county, at a lower level that we're at a county, because I'm assuming if we're talking about Medi-Cal, a lot of that money wouldn't be filtered down from the feds as far as whatever the new restriction or requirements are coming, depending on the actions that are coming that we don't know about yet this time.
Yes, that is a great question for us all to keep in mind, not one that I necessarily have an answer for right at this time. David, I don't know. I saw you come off mute.
Yeah, so with CalAIM specifically, those programs supposedly, according to communication now, do have the remainder of this year and another year of funding. So those demonstration programs are there. The concern is that those demonstration programs become a target as a way to use within those cuts. The good thing is we can obviously show the return on investment with the programs already, and what they're seeing and how much it's able to reduce cost. What the concern of what could happen is essentially the state will have to examine those costs, and if that's going to come out of certain portions of things that they are spending dollars on. And then of course you have the issues with who's getting served or who's not getting served as being the biggest deal as well. But I will say right off the bat, it's not an immediate danger, but it is coming. You know, at some point, it's gonna have to be handled, whether the feds decide to continue to approve them, or they say, oh, we're getting away from those style programs altogether.
Yeah, David, I guess I'd add that in relation to what we're learning about today, that the data that we collect in these kinds of projects goes a very long way in proving the value of the project, you know? So this is that kind of a proof in the pudding that we like to collect. So when we do encounter those pushbacks on funding, this is our evidence that stuff works.
Yeah, one thing I want to say too, like what was always important in developing these, you know, Julian, you talked about using that find help, and you have these referrals. When you're setting up the system, part of that is once you have those assessments, you think about who you commonly refer to for outside services that maybe your organization doesn't operate. When you're able to also put in the system to say, if I'm referring to this service or this agency for a service, that I intend for there not to just be an output, but there to also be an outcome. It's a good way to track that as well. So if you have something that's a local service that you tend to want to refer people over, and you either see that service is not being obtained or that service is not reaching the desired outcome that you need, then that's a good opportunity to use that information to possibly reevaluate where you refer to. But what really helps create as well is the sense of follow-up in that, understanding that, hey, if I don't get that transportation need met, I'm never going to move on to education or to employment goals. And I think that's always been very valuable for me in looking at the holistic whole family approach here.
Yeah,
I got
please.
another question.
Mhm.
The reason I'm asking because we're kind of doing the same process in our current county. Now, I'm assuming when you gather the documentation, the data, and the information you need to support these programs that are being ran, how are you verifying with ID if you are using a form of ID, let's say a driver license or whatever it may be, to verify there in whatever county, district, or ever you're at? But my question is pertaining to ID, because the current administration at the Fed are targeting certain individuals who are not identifying as their gender preference. And I know here in California, we have I don't know if it's still within, when they do the ID, they don't have to identify themselves as a certain gender. You know, they can use pronouns. So how do we not get around that, but how do we address that, and how do we use other forms of avenues, if you guys have come across that yet, without violating or becoming a target on the current administration within our county or within our region that we're trying to accomplish with documentation?
For this program in specific, there isn't a lot of documentation required, and we did let case managers know right off the bat that if there were any parts of the survey or the intake or eligibility that families felt uncomfortable answering for whatever reason, that they could go ahead and leave that question blank. That's kind of just how we've been doing it now. We haven't been asked to report any of this information. The information that we have given to the feds at this point has been just good information that we wanted to share, like impactful information. I'm not sure what it would look like if they came and said, hey, download all of your data right now from your data system and let us know. I'm sure we'd have some pushback there. But yeah, David, I don't know if you had any more to add there.
That's perfect answer. Most of what it is they've just realigned. We used to have categories that were other or multiple other categories, but essentially now with this administration, they're just saying in theory that it's male, female, and then the other one is undocumented. So essentially just saying, you know, I refuse to answer. And it's really, that's always kind of been there. It just had other in there, and it had different ways of saying that I don't fall into either one of these categories. Now it's just like Jillian said, it's either you claim one of these twos, or you say, oh, well, I'm neither, and then you just write down undocumented and move on. I mean, that's essentially. there's no requirement that you have to identify your sex to get services. The only things you really have to identify are income and typically household members, so depending on what program it is.
Any other questions? Yeah, good
I
doorbell.
like to mention something. In this area, some of my assessments, especially the ones when they start, when I do the assessments at this time during the summer, it's like most of the families are working. But the assessment is due in 6 months, is around November. Always the scores go down because the families, the job depends on agriculture. So most of the families are not working. And they are requiring the services like a food stamps or the public assistance. And then they go back to the point, up
Yeah,
around this time
Yeah.
again. So, and if the family was disclosure during the winter, it's gonna look like, they're gonna score lower.
they did worse. Yeah,
And they start. Because
yeah.
this time they are working.
Mhm.
I just want to mention that because probably my numbers are gonna be like,
That's okay, doorbell.
backwards.
Yes. That's the important part of the adding the narrative to the data. So yes, data is super important and it helps with our storytelling. But like you said, doorbell, and like I mentioned in some other parts too, we have those explanations for why the data might be moving the way it's moving. So thank you for pointing that out as well.
Darcy Dahlia Drive.
Any other final comments, questions, or concerns? And if anything comes up or you introduce this to your team or have more questions or want to build an assessment or need help with scales, always down the line, please feel free to email us. All right, well, barring none, I will give you all 20 minutes back of your day. Thank you guys for joining us. I hope we have more of a discussion next week during our planning group about different program management techniques. I'd love to hear from you all what you've learned as program managers. Like I said, this is kind of the only program I really oversee as a program delivering services to people. So I'm excited for that roundtable next week to talk more about other techniques y'all might have. All right, well, thank y'all. I'll let y'all go. Have a great rest of your day.
Bye.
Bye.